It's late afternoon, February 2023. When I arrive at what some call Israel's San Francisco, picturesque Haifa. So you make this walk quite frequently to go visit your father?
Yeah.
That's got to be kind of nice.
Yes, because I'm glad that I'm coming to make him happy.
Shalom.
I meet up with 69-year-old Ruthie Ben Shalom. Energetic, lively, and above all, a very good daughter.
They know that he has memories, but he cannot walk with them.
It's been a rough road for her father, Joseph. What was he like before the dementia?
He touched everybody.
Was he very warm?
Very, very warm.
But then 2 years ago, after his diagnosis, something changed. Something that happens to nearly 90% of patients with dementia.
He started to be angry, cursing, shouting, hitting. It was very, very scaring.
I'm sorry.
Yeah, I knew that this is not my father.
When patients with dementia start having aggressiveness, the family members are in a very terrible situation.
I was pretty skeptical. Dr Vered Hermush, a geriatrician at Laniado Hospital in nearby Netanya. She's been on a mission to try and treat what so far has been almost always untreatable.
The first thing in the medications that you give them are the antipsychotics. Medications that can increase their probability to die. They can kill them.
The doctor gave us medicine for him, but he started to be like a zombie.
Hermush had an idea for older patients like Joseph based upon what she had seen with some of the youngest.
When I saw that cannabinoids are approved for epilepsy for children, I thought if they can help here, they might help in the behavioral disturbances of dementia.
It was a simple theory. During a seizure, the brain has these sudden outbursts of electrical energy, kind of like what you see here, and that can lead to physical outbursts. Hermush thought the same thing might be happening in dementia patients, leading to behavioral outbursts.
Avidekel was tested in so many clinical trials.
So, with the help of Lihi Bar-Lev Schuleiter, they put it to the test. 60 patients, average age 79. Half got Tikkun Olam's cannabis oil, which is 30% CBD and 1% THC. The other half got a placebo, and no one knew who got which. After 16 weeks, there were no serious side effects in either group. But the cannabis group had significantly reduced agitation. They also found something that surprised them. In some of the cases, patients were also able to reduce the other drugs they had been taking. Again and again, it was more plants, fewer pills.
I had a patient, she was getting 4 or 5 medications to control her hypertension. With the cannabis, we stopped all the medications.
And there was one more thing.
There's this one 98-year-old that he started reading.
So their cognition actually improved.
Actually improved.
And do you think it's because the cannabis is protecting the brain somehow?
Could be. Could be.
Very early studies in mice show something we have never seen before. That is that low-dose THC was actually seen to reduce the amount of plaque in their brains. It is early, and it is mice, but
the big question will be what that looks like over a longer course in human subjects.
אבא, אהלן, אבא, מה העניינים? מה נשמע?
But in the meantime, Joseph and his family, they're not waiting for any trial results.
So this is it, huh, Ruthie?
Yes, this is the Demon clip. It changed his life.
Twice a day, he takes this cannabis oil that Dr. Hermush recommended.
And it sounds like he's a different man.
He come back. It's bring him back.
While making this film, I saw scenes like this play out over and over again.